Hi, my name is Alejandra Lumbreras and I'm going to be demonstrating how to perform tracheostomy care on a patient. So first I'm going to go into the patient's room, perform hand hygiene, identify myself, verify the patient identification, explain the procedure to the patient, and then I'll follow to assist the patient into a high Fowler's position. So I'm going to go ahead and knock, perform hand hygiene. Hi, my name is Ale. I'll be the student nurse taking care of you today. Can I go ahead and get your name and date of birth, please? I check the patient's bracelet, identification bracelet, and the patient states the correct name and date of birth. So I go ahead and proceed to explain to my patient what I will be doing. So I'm here today to perform tracheostomy care. So what that is that I will be removing your inner cannula so I can go ahead and cleanse it and rinse it, as well as clean around your stoma and your faceplate. And this is to remove any residue and to maintain your skin's integrity. But before I begin, is there any questions or concerns about the procedure? The patient states no. So I go ahead and elevate the bed to my work level and elevate the head of the bed to place to position the patient into a high Fowler's. So once the patient is already positioned, I go ahead and perform hand hygiene and don clean gloves. So once my clean gloves are on, I can go ahead. I'm going to start off by removing the old dressing. So we're going to go ahead and do that. Okay. And we go ahead and dispose of the old dressing as well as the gloves. Okay, so we go ahead and perform hand hygiene again. And I'm going to proceed to opening the package. Okay, so first I'm going to start off by draping the patient, and this is just to avoid getting any secretions on your patient's gown. Okay, after that we're going to go ahead and don sterile gloves. Okay, but first I'm only going to don a sterile glove on my non-dominant hand, and with my on my dominant hand, and with my non-dominant hand, I'm going to open the normal saline and pour it into the 3 trays. So I'm going to first don a sterile glove on my dominant hand. Okay. I'm going to go ahead and move this with my dominant hand sterile. Okay, and I'm going to go with my non-dominant hand, I'm going to go ahead and open the saline and pour it into the 3 trays. Okay, after doing that, I can go ahead and now don a sterile glove on my non-dominant hand. Okay, so the first thing that I'm going to do is remove the patient's oxygen source and place it near the patient. And with my non-dominant hand, I'm going to go ahead and remove the inner cannula and place it into the first tray with the normal saline. So with my non-dominant hand, remove the inner cannula and place it into, and after doing that, you want to replace the oxygen source back to the outer cannula. Okay, so we replace it. Okay, so now with my dominant hand, I'm going to pick up the cannula and clean it with the brush. So I'm going to go ahead and get the brush. My dominant hand. And when you're cleaning the cannula, make sure that you do clean the inner and the outer surfaces, just to make sure that there isn't any secretions on there. Okay, once you're done cleaning, you can go ahead and place the cannula in the second tray with the normal saline so it can rinse. Okay, so once it is rinsed, you can go ahead and place it back into the, you can go ahead and replace it with your dominant hand. So I'm going to go ahead and insert it and make sure that it locks. Okay, so once the inner cannula is in, you can go ahead and proceed to cleaning the stoma and the faceplate. So with with your dominant hand, you're going to go ahead and pick up a cotton tip applicator, dip it into the normal saline in the third tray, and you're going to clean. So the way that we're going to clean is we're going to start with the area above the faceplate and then followed by the area below the faceplate. So with my non-dominant hand, the tip applicator, we're going to dip it into the normal saline. And we're going to go ahead and start. Dispose. Make sure that you do get a new cotton tip applicator for every area. Okay, dip it in the saline. Okay, and then with the third applicator, dip it into the saline, and now we're going to clean the faceplate. Okay, we'll dispose of that. Get another one, dip it into the saline. Dispose of that. Okay, so once that's done, you're going to proceed to clean again with a gauze, but now with a gauze. So we're going to go ahead and get a gauze, dip it into the normal saline, and wipe around. Dispose. Dip it into the normal saline. Dispose. So now with a dry gauze, we're going to just pat dry around. Okay, and dispose. Okay, so once that's done, and once it's dry, you can go ahead and proceed to apply the new dressing, which is the fenestrated gauze, which would be this one right here. So we're going to go ahead and apply that. Okay, so now after your clean gauze is already on, you can go ahead and then proceed to apply the new trach ties. Just make sure that you do apply the new one before you remove the old one. So I'm gonna use, they provided me with this one, but I'm gonna go ahead and use my ribbon. This is gonna go around the patient's neck. And when you're doing this, do make sure that the tie isn't twisted in the back and that it's straight, it's flat. Okay, and once it's on, you can go ahead and proceed to remove the old one. Okay, once you already removed you had already placed your new tie and removed the old one, you do want to make sure that you allow one loose finger or two snug fingers between your patient's skin and the tracheal tie. Um, After that, you just want to make sure that your patient isn't once you're done with tying it up, and you make sure that you check that it's either one loose or two snug fingers between there, then you can just go ahead and assess your patient, make sure that your patient isn't having trouble breathing, and if they're not, you can just go ahead and dispose of your materials. Perform hand hygiene. Okay, you can just go ahead and ask your patient if everything is okay, if she's feeling all right, if everything is good. You can go ahead and proceed to ask, is there anything that I can do for you at the moment? The patient states no, so you can go ahead and just lower the bed to the lowest position, make sure that the call light is within reach, and let the patient know that if they do need anything, just to make sure that they do use that call light. After that, you can just go ahead and proceed to document. You would be documenting your patient's tolerance to the procedure, as well as the assessment of the tracheostoma. And after that, you can just go ahead and perform hand hygiene and excuse yourself. And that's it.